And you can check out KGNU here at kgnu.org. I'm Shelley Schlender. It's 8:35. You're tuned to the end of the Heart Attack Chronicles, where we have two guests in the studio who are experts on heart disease and heart health, who are going to share with you their insights about how you can keep your heart healthy. And let's go ahead and have each of you introduce yourselves. Welcome Jamie Doucet and welcome Jeff Gerber. Jamie, let's start with you.
I'm Jamie Doucet, and I practice here at Boulder Heart for Boulder Community Hospital. I'm an interventional cardiologist, so I treat heart attack victims and patients that have acute coronary syndromes where their heart is threatened with heart attack.
When their heart is threatened with heart attack, how do you tell?
Usually with EKG and the patient's clinical symptoms, as well as measurements of biomarkers from the bloodstream.
Jeff Gerber, welcome to KGNU. Tell us about yourself.
Thanks, Shelley. I'm a family doctor, and I'm located in Littleton, Colorado, and I have incorporated nutrition as a tool to help patients treat chronic diseases such as heart disease, heart attack, stroke, diabetes, and obesity. And I must say that our approach to nutrition is non-traditional. We focus on low-carb, high-fat diets and also ancestral Paleolithic diets.
Jamie Doucet, what do you think about high-fat, low-carb diets and ancestral diets?
In the early 90s, it was very popular to go extremely low-fat to try to prevent or reduce the risk of heart disease. And actually, those studies, if you look at them, they were very specific. They were high in fiber. They were low in calorie compared to expenditure. So it truly was a weight loss type diet, and then extremely low fat, less than 10 grams a day was what Dean Ornish recommended. And actually, if you did follow that high fiber, reduced calorie diet, you could see reductions in coronary disease by following a diet such as that. But I believe the food industry took that to mean that it didn't matter if you ate carbs or sugar, and they said we can make everything low fat. We'll put sugar in the diet. And I think that whole mantra is what's responsible in large part for the obesity epidemic in our country, along with inactivity, of course.
How is heart disease doing in the United States? Are we doing a better job at avoiding heart attacks?
Yes, cardiovascular mortality is down by 50% over the last 10 years, so there have been great strides in large part because of family docs like Jeff who have put patients on medications and also focused on diet and exercise as a way to reduce disease.
Truly, when we look at some of the data over the last 10 years, all diets probably work, including the low-fat, low-calorie diets, because you're reducing calories in total and possibly, well, not possibly, definitely reducing carbohydrate load in the diet. And we believe that carbohydrate, especially refined and processed carbohydrates, are responsible for inflammation and oxidative stress. And those are some of the factors that we want to look at in diet in the 21st century, eating clean foods and unprocessed foods.
I always tell my patients that if it comes in a bag or a box, it can put you in one. So I think it's not good to eat processed foods that has extremely long shelf lives. It's not good for your body.
And you're not a fan of sugar in the diet, too, and there's a lot of sugar in the American diet.
For sure.
What do you think of cholesterol and checking the blood cholesterol of somebody? How important is that today? Because that's what most people think about when they think about checking for heart attack risk.
Yeah, we were talking about this before we came on air, and I'd like to hear Jeff's comments, but I think that the disease that is blockage or atherosclerosis that forms in arteries and causes them to harden and become dysfunctional is related to an initial injury of the lining or skin that lines the inner lining of the blood vessel. And then at any level, be that injury caused by elevated pressure in the blood vessel, smoking, elevated sugar, and diabetes, or elevated cholesterol, all of those would help to lead to further plaque formation.
And so it's a scratch inside of the arteries, or it's a pimple, if you will, that the body's trying to repair, and that causes it to put things on it that don't always help the artery in the long run.
That's my view of it, and I think that that's consistent with what the biology would show. What do you think, Jeff?
Well, I agree with you 100%, Jamie. And specifically about cholesterol, I really enjoy talking about this because there's some new views about cholesterol and its role in atherosclerotic plaque. And so traditionally, based on some principles that we refer to as the diet-heart hypothesis and the lipid hypothesis, says that it perhaps is the lipoprotein or the cholesterol molecule itself that is directly causing endothelial dysfunction. But of late, for myself in the last 10 years, there's this new concept that it is actually forces of inflammation and oxidative stress acting on the lipoprotein molecule itself that's responsible for inflammation. And we think of cholesterol and lipoprotein molecules perhaps as innocent bystanders that are victims to inflammation and oxidative stress.
Well, let me see if I'm understanding this right. A lipoprotein is the bag that carries the fat, the cholesterol, through the bloodstream. The endothelial cells are the linings of the arteries. And so you're mentioning that it may not be the fat that's being carried in the bag. It may be something wrong with the bag carrying the fat, the protein bag, that causes more of the inflammation that irritates the arteries.
Yes, that's correct, Shelley. And we have fortunately or not, referred to this as the general issue of cholesterol, but it's really this complex molecule known as lipoprotein that interacts with this endothelium.
And the quality of that protein affects the quality of your health.
Correct.
Jamie Doucet, the American Heart Association is not a fan yet of saturated fat. What do you think?
Well, I think that hard for me to say this out loud and on air, but I'm not sure that the American Heart Association has always had a great feel for what dietary things we could do to improve health, especially in regards to heart disease. And if you look at diet as a predictor of survival, actually the people that live the longest live in fertile river valleys near where there are floods and river deltas, and therefore it goes without saying that those people eat more organic produce, and their produce is actually higher in quality. So I think that what Jeff is espousing or talking about is exactly correct, and that is that we eat way too many carbohydrates, we eat way too many foods that are inflammatory and overly processed for purposes of storage, as opposed to and we don't really have those needs any longer that we have modern refrigeration, etc.
You mean the shelf life is better, but unfortunately these kinds of foods cause more storage on our bodies of fat.
I think that's true.
What would the American Heart Association say with you, a cardiologist, saying things like this?
I'm not sure. I think that a lot of them, that if they really studied the science behind diet, they would understand that if you feed someone an increased calorie diet compared to expenditure that is low in fiber, they do that north of here in Greeley to a sedentary population, and they do that in the feedlots with cattle. So that's a good way to fatten someone up. And that's exactly the way the diets that were espoused by the American Heart Association in the late 80s and early 90s, if people didn't follow the high fiber part and the reduced calorie compared to expenditure until they got to ideal body weight, then it's a way to create an obesity epidemic and an epidemic of diabetes.
Who is Roger? Hold on just a second, Roger, and we'll get you on the phone. Roger, welcome to KGNU.
Good morning, Shelley. What a great program. I'll be brief. I'm wondering if your guests are familiar with John A. McDougall, MD, and his various programs, especially his latest book, The Starch Solution, where he advocates a lot of rice and beans and potatoes and those kinds of things, little or no meat and no processed foods, combined with exercise and other healthy initiatives. Are your guests familiar with John McDougall, and would they support something like the starch solution?
Steve Parcell, let's let you talk about this first.
I can't stand protocols named after doctors or solutions or anything like that. You know, diet is not one size fits all. And just as our previous guest said, you know, you have to match the diet to the patient. If this is an insulin-resistant patient or a diabetic patient, that would be a disaster. So these one-size-fits-all diets are terrible. There's basically good carbs, good proteins, and good fats. And the reverse is also true. There's bad fats, bad proteins, and bad starches, and bad carbs. And, you know, of course you could do a low-fat, high-carb, high-fiber, good, healthy carb diet, but you got to match it to the patient. You know, in some patients, their lipids are going to get worse. Their small LDL will increase on a diet like that. So I don't like that. There is no magic bullet dietary solution for reversing plaque, unless you're going to go super low fat and do the Ornish deal, because that's been clinically proven to work. But most people can't sustain it.
Steve Parcell, does that Dean Ornish style, very low fat, very high carb diet work for everyone, or are there also people where, say, they're diabetic? Does it work for them?
No, it doesn't work. In fact, depending on your apolipoprotein E genotype, a high carb, low fat diet might actually make your small LDL increase and make your HDL go down.
How could somebody figure out if they're a good candidate for the McDougall diet or the Ornish diet?
Well, I like to do the ApoE test and as some kind of guidepost.
So that's apolipoprotein E, which is a certain kind of basically bag of cholesterol that's going through the bloodstream, or bag of fat.
Well, it's genetic polymorphisms in the metabolism of cholesterol, and there is some data to suggest that, you know, moderate fat Mediterranean diet is better for one, and low fat's better for a certain other type, and then, you know, and it tends to work when you do follow up lipid profiles.
Would one of you other doctors like to comment on this as well? This idea of going on a low-fat, high-carb diet, the kind that Roger has suggested.
So, yes.
So Jeff Gerber.
Sure. Yes, Steve. So the ApoE genetic testing, I think what it demonstrates is that people are different genetically, and they have a different response to dietary modification and how that affects LDL particles. And as you probably are aware by now, I'm not very fond of these very low-fat, high-carb diets. And I agree with Steve that some people can have the reverse effect. Some have even challenged the data of Dean Ornish. And so perhaps... I mean, I just can't find a role for an extreme low-fat, high-carb diet in 2013.
Dr. Jamie Doucet, cardiologist, what's your comment?
I think that what Steve and Jeff have already said is quite correct. The data on high carbohydrate and extremely low-fat diets was again from Ornish and a guy named Lance Gould, Gould, who's at the University of Texas and in Health Sciences Center in Houston, and I actually trained under him directly, so I actually know him personally. And Lance, or Dr. Gould, please forgive me if you ever hear this, but he's he's 6 feet 6 tall and weighs about 180 pounds. He's extremely thin, and he does follow a extremely reduced calorie diet compared to expenditure. And is quite lean. It's hard for people to stay on that diet, like Steve mentioned, where it truly is reduced calorie compared to expenditure. One of the main things that tells you to stop eating is fat intake. And when you don't have that, or you don't have the will to have that assistance, then people tend to then cheat on these types of diets, and then it becomes the worst kind of diet you could possibly be on.
Well, people can cheat on a high-fat, low-carb diet also.
And that's bad for them as well, and it doesn't result in as good of lipid profiles. I totally agree with both these physicians that really there's not a single diet that works for everyone. If you have prediabetes and you go on a high-carbohydrate, extremely low-fat diet, your triglycerides will go up, your HDL will go down, and your LDL will be unchanged or slightly reduced. And that combination would be bad for your heart and your vascular system, in my view.
If you would like to call and share your comment or question with our panel of experts, the number is 303-442-4242. This is a show on heart health. We have just a few minutes left. Roger, since you're still on the line, what do you think of these comments from these doctors about the McDougall diet?
Well, I don't know that much about it, but they sound very insightful, and it gives me a lot to think about because, as one of the doctors suggested, he wasn't comfortable with an author suggesting a one-size-fits-all diet. And that seems to be the case with John McDougall and the starch solution, although McDougall bases this on human history and what our ancestors ate and all those kinds of things. So it gives me a lot to think about, and I really appreciate their comments. Thank you, Shelley.